Hello guys, my name is Dr. Shubham Malhotra. I recently graduated from Ukraine in 2022. Today we are going to study very important topic, JVP. So let's start. JVP guys, the full form is jugular venous pressure. This is the waveform of JVP, A, C, X, V, Y. It has positive waves A, C, V and negative waves X, Y. Positive wave means the waves which have upward trajectory and the negative wave means which have downward trajectory. Okay, so let's start. Guys, always remember the pressure change in right atrium is directly linked to the jugular vein pressure. Okay, first of all, keep this thing in mind. Now we are going to correlate with this waveform with cardiac cycle. Okay, so first is atrial systole. The atria is going to contract. So guys, when atria is going to contract, the pressure in the right atrium will increase, and as you know that the jugular venous pressure is directly correlated with it, so the pressure in the jugular vein will also increase, and this shows A wave. And now the second thing is isovolumetric contraction. So now guys, as you know, after the atrial systole there is a phase of isovolumetric contraction. So when the pressure inside the ventricle is increasing, this will push this tricuspid valve upward, and this will increase the pressure in jugular vein. As you can see the pressure, this pushes the tricuspid valve up. Yes, so the right atrium pressure will increase and the pressure in the jugular vein will increase. So this shows C wave guys. Okay, C wave. Now what does this mean? S1 is M1T1. That means the first heart sound guys, mitral and tricuspid valve. Because in isovolumetric contraction these valves are closed. So the closure of the heart sound, that the first heart sound is correlated with C wave. Okay guys, if you want to remember it you can, otherwise leave it. Okay, now we are moving on to the third, that is after the isovolumetric contraction, now the pressure inside the ventricles are much higher than the aorta. Yes, so what will happen? The left ventricle is going to push blood to the aorta and the right ventricle is going to push blood to pulmonary artery. So guys, as you know, the pressure in the ventricle will decrease, the pressure in the right atrium will decrease, and the pressure in jugular vein will decrease, and this will show X descent guys, X descent. And the X descent is directly correlated to ejection click. What is ejection click guys? Ejection click is when the ventricles, when the aortic valve and the pulmonary valves are open and the blood is thrown out of them, and this thing is known as ejection click. Okay guys, so this is X descent. Now again, what is going to happen after, now when all the blood is thrown out of the ventricles, now what will happen? Now the aortic valve and pulmonary valve will close and the mitral and tricuspid are still closed. So this shows isovolumetric relaxation of the ventricles. So the passive filling of the atrials will start now. Passive filling, yes, as you know the atria is like 70%. So now when the blood is going to come in right atrium, again the pressure in the right atrium is going to increase, so the pressure in jugular vein is going to increase, and this shows V wave. Easy. So and the V wave corresponds to second heart sound, because second heart sound is produced when aortic and pulmonary valves are closed. See, these are closed, yes, and these are still closed. So this is isovolumetric relaxation. The passive filling of the atria starts. Yes. So this increase. This is the thing. Now after the V wave guys, we are on to Y descent. So guys, now after the isovolumetric relaxation, we are on to ventricular diastole. Yes. because the pressure in the right atrium and the left atrium has increased to a point which opens this tricuspid and mitral valve. So the blood will come down to the ventricles. So the pressure in the right atrium has decreased. The pressure in the jugular vein decreased. So Y descent. And this corresponds to the opening snap, guys. Opening snap corresponds to the opening of tricuspid and mitral valve. So this is the full JVP. I hope I'm able to make you understand. And if you like it, so please like and subscribe to my channel. Thank you, guys.